Hey guys, the George Subraj Foundation is giving away $1 million towards cardiac care. This initiative will benefit Guyanese right here in Little Guyana as well in Guyana. Let's go over to LIJ Northwell in Forest Hills to find out more information about this wonderful grant. So we're about to enter here at this wonderful event at LIJ Northwell in Forest Hills. Guys, now Stancy, tell us what's happening today.
Yeah, so on this amazing windy day, we're here as a Northwell family, joined by LIJ Forest Hills, the hospital that we're at, Centers for Global Health, and the Subraj family and our community leaders and stakeholders. We're thanking the Subraj family for their $1 million donation to support the work that's ongoing in Guyana, and also to establish a local connection here to the work that Northwell's already been doing in Little Guyana. So it's a very special day, and we're so happy to celebrate this moment with the community.
Wonderful. Let's go in and check out the celebration.
So I'm Eric Choi Pena. I'm the Vice President of Global Health and the founder of the Center for Global Health here at Northwell. I am responsible for all of our global programs, which include one of our largest sites in Georgetown, Guyana. We've been working there since 2017 and have really scaled up our activity since 2021, signing a 5-year agreement with the Ministry of Health, with the Georgetown Public Hospital Corporation and the University of Guyana. We have over 17 clinical departments engaged in Guyana. It's, like I said, our largest site, and we have staff in Guyana 24/7, 365 days a year. So really proud of this, and really proud of the partnership with the Subraj family to really take the efforts that Northwell has been providing in kind and amplify and make it bigger and better and more impactful.
Viewers, we are here with Lorraine Chamber-Lewis. Lorraine is the president here at LIJ Forest Hills Hospital, where this wonderful event is coming together today. Lorraine, tell me a little bit about the program here at LIJ, specifically for cardiology.
So in our cardiac program, we're actually expanding, we're bringing on more doctors, making sure that we have the outpatient cardiologist that's available for folks, planting them in different parts of Queens, because I really firmly believe that a lot of health is going to be about your access to care. So it's important for us to have cardiologists in the community and keep expanding that, particularly for this community.
Now, this show is specifically geared for Caribbeans, and I'm not too sure that many people know that there is a cardiac care right here in Forest Hills, Queens.
Yes.
About what is the percentage, would you say, of West Indian people that come here for cardiac care?
I wouldn't know the specific number of how people come for cardiac care because people usually don't tell us specifically what country they're from.
Okay.
But there's definitely, my family's from Jamaica. There's a large amount of people in this community overall that are from the Caribbean and that diaspora, as well as working here too. And so there's a connection between the community and the people who work here that understand that heritage and that culture. And we really make sure that the folks feel psychologically safe in communicating about their different needs and the challenges that they have. And that's part of, if you're working in the middle of Queens, you have to kind of understand culture. And it really helps that many of our team members are from the Caribbean in these areas and from Guyana.
And they understand the diet and the care. Yes. So we want to encourage people that are in the area that there is a cardiac department right here in Forest Hills.
Yes.
Anything else would you like to add to our viewers?
I think that it's important with the work that we're doing and the donation that's happening with this event, that we are already doing a ton of work in Little Guyana, and now we can do even more, make more of an impact and partner with us. Part of what we're doing is making sure that we're listening to the community and that they're telling us what they're looking for and what their needs are and where their struggles are, whether it be diet or other areas. We're here for it. We're here to work with them. And so this means everything to us to have that partnership with community folks and leaders.
Lorraine, have you visited Guyana? Have you visited down there with the Century just as yet?
Yeah, I was just invited to go. I'm really excited to in April to potentially be a part of that. Okay. I'm excited to go there. I have a lot of friends that are from Guyana, so they've been telling me all about it. And it's great. So I love to travel, love to see other countries, and really embrace myself into the food and the culture and learn more. I think that and experience will help me do more work here.
Well, congratulations on being the recipients of
Thank
this
you.
grant.
Thank
It's
you.
wonderful, and
Yes.
I know you're going to continue the great work that you've been
Yes.
doing here
Yes.
and in the Caribbean.
Right here in Queens is the largest diaspora of Guyanese outside of Guyana. And the community makes up our patients, it makes up our team members, and they're part of our Northwell family. And so for us, working in Guyana was the natural iteration of that relationship. And I'm really excited about where we're going. I think the road ahead, we've got a lot to be proud of, but the road ahead is going to be even brighter and greater. So, without any further ado, I'd like to introduce the head of the George Subraj Family Foundation and the CEO and president of Zara Realty, Tony Subraj.
Thank you and good morning. It's a bit cold today, huh? Thank you all for taking the time to watch the video today. As you've seen, Zara Realty began with humble roots in 1982 when my father, George Subraj, and his brothers bought their first building here in Queens. Their vision was simple yet powerful: build strong communities through responsible, compassionate action. My father was a self-taught man, never receiving a formal higher education. But if he met a stranger on the street, he would take it upon himself to share his knowledge, to help, whether it be in housing, education, and more so health. As you saw in the video, he dedicated over 2 decades of his life to community service. Today, we proudly announce a significant step to continue his legacy: a $1 million partnership with Northwell Health dedicated to improving heart health in Queens and Guyana. Heart disease, often hidden until it strikes suddenly, disproportionately affects our Caribbean and South Asian communities, making early detection and preventive care absolutely critical. This initiative, deeply rooted in my father's belief that generosity and community support are paramount. This will provide life-saving screenings, education, and preventive care to thousands. I have to also thank my mom, Gloria Subraj, for her dedication in continuing my father's work. Without her, none of this would be possible. And of course, my wife, Viva Subraj, whose constant support allows me to be here today. Thank you all for your continued support as we honor my father's legacy and build healthier, more resilient communities together. Thank you.
Thank you, Tony. I'd like to now invite up to the stage Mr. Ken Subraj for some comments.
All right, this project has been in the making for a very long time. I just want to get my numbers right. This morning I was talking to Dr. Johar, and he confirmed this, what I thought was the right date. It didn't go back since 2013 or 2012. Matter of fact, he assured me started since 2008. So it's actually a very long time to a project to get underway. But this project, as you probably will notice, affects all of us here. All of us can have that problem. Doctor mentioned that this area is the heart of the Chinese community, Queens. What percentage you had?
So
What percentage you had?
I just know it's the largest diaspora outside of Guyana. I don't know the percentage in Queens, but it's.
I used to have that number. It's going now. Anyway, I just want to make sure that you guys register that we've been in business for the last 42 years, 42, 43 years, and we've done a lot for society, not only cardiology, but other areas. As Tony mentioned on the tape, you can't hide that, that's facts of life. And you guys register it, it sort of goes a long way.
Just want to commend what Tony said and to compliment it that his dad started this medical work in excess of 30 years. A matter of fact, his first mission to Guyana was with something called Guyana Watch. That's where he started with a team with Tony Yassin, some other West Indian colleagues, or Guyanese colleagues, other doctors. And from since then, it was a race to the finish. Today, George is watching on us, and he's saying, guys, the race hasn't started yet. And what Tony is doing here today with his mom and the foundation, he must be commended. It's a tall order. He's a tall guy. He can handle it. In addition to what Tony said and what you saw on the tape, we're supporting lots of programs here and in Guyana on the religious side, on the medical field, which I wouldn't comment on that. Tony is big behind it, and also on the education field. Only recently, as a matter of fact, 2 years ago, my elder brother Ken, he opened a new institute in Guyana, the Government Technical Institute, which is the backbone of technical education in Guyana. We are both proud to say we are alumni from that school, and we are both engineers by profession, whatever that means. And from in leaps and bounds, we have moved it on. We supported in Guyana in excess of 30 computer centers and educational programs, covering all the entire length and breadth of Guyana. In addition, what we've done here in North America. Dr. Eric talked about the Queens diaspora. Well, we did the first computer center at Richmond Hill High School some 7 years ago. When we opened that center, it's one of the best in the Board of Ed here. Yes, and we're proud to say we did that one.
Without further ado, I'd like to introduce Dr. Rajiv Jauhar, our cardiologist and VP in charge of cardiology in the region, to give some remarks.
Eric, thank you very much. Heart disease among South Asians and Guyanese people is an epidemic. We've done a very good job with TB, with smallpox. We've not done a good job with heart disease. Just to give you one data point, in 1968, heart disease among South Asians and Guyanese and Americans, Caucasian Americans, was exactly the same. Caucasian American heart disease has dropped by 50%. Guyanese heart disease has increased by significant amounts. That is a huge problem. I met George in 2003. He was my patient. He then became my friend, and then he became an advocate. We had dinners. He wore that classic fedora hat. He wore it. I think he went to bed with the hat. But we had so many dinners together, and we used to go to this restaurant in New Hyde Park, which was his favorite. And he'd have his tandoori salmon. That's all he would eat. At least, maybe he's trying to show off to me. I'm not sure, but that's what he would eat. And he would look at people around. They mostly were Guyanese people, Indian people, and they said, "Look at those guys eating." He does not understand. And that sort of led to a discussion about creating his vision. Now, he'd already had a vision with kidney disease and cataracts and retinal transplants, but he really wanted to pursue heart disease. So we talked since 2003, but in 2008, Ken, you're right, we started discussing going to Guyana. And then in 2015, he had a team of us go down to Guyana, and we saw about 110 patients in about 2.5 days. George could have easily gone away. He stayed and talked to every single patient. Socially, how are you? How are you making ends meet? Talking about their heart disease. And he would give them advice about what to eat, which I found humorous. But he was all into the process. And we got to do several procedures down there. And I remember we were walking in the hospital in Guyana, and this lady just walked up to him and said, "You're Zara." And I didn't know what Zara meant back then. And I'm like, "What does he mean, Doc? You're Zara Realty." And she goes, "You're the one who's helping all of us down here." And she literally touched his feet. She was so impressed and so in awe of him. So I'm just honored to be part of what Tony, the foundation, is doing for cardiology and the Global Health Initiative here at Northwell. I think this partnership will be symbiotic. I think we will help people in the Guyanese community, whether it be in Guyana or in the Queen's diaspora. We are really, our purpose is really to create pockets and to help educate people about what they can modify. You can't modify your genes, you can't modify your age, but you can modify what you eat, your high blood pressure, your diabetes, your smoking habits, stress levels, and so on and so forth. So with Tony and his family, I know them all for so many years now. We appreciate it, and I think this is going to be a great partnership. I look forward to working with you over the next several years. Thank you all very much.
Who's the advisor to the president of Guyana, right here, right by the heart. Joe, I mean, this initiative is going to touch so many people, touch so many lives, touch so many hearts. Tell me about the partnership with LIJ and Guyana.
So interesting you're asking, Lakshmi. This partnership, as a matter of fact, I want to go back a little bit further. And I want to talk a little bit about George Subraj and his foundation here. So as you said earlier, George has been doing a lot of philanthropic work in Guyana for many, many years.
Yeah.
Going back to kidney
Okay.
transplant, ophthalmology, etc. Cardiac disease, as you know, is one of the leading problems, not only in the Guyanese, but many individuals across the world. And Guyana does have a cardiac institute. And I think what LIJ is doing here in collaboration with the George Subraj Foundation will go a far way. Not only in the terms of treatment, but in terms of education, in terms of prevention, in terms of helping Guyanese who can't afford the more sophisticated medical care that's in North America, bringing that kind of treatment, bringing that kind of care to Guyana. And Northwell Health, as you know, is well known. They have a very huge cardiac disease unit here in New York, and bringing that expertise in Guyana, in collaboration with the George Subraj Foundation, will make a big difference. Make a big difference in terms of the health, not only for Guyanese, but right here in New York, where we have a very, very large Guyanese diaspora.
Wonderful. I know that in Guyana there are more new modern hospitals coming up. Will nurses and doctors from this hospital be working there?
I know there is a discussion in progress where there's a reciprocal training program for local Guyanese in Guyana to be trained and brought up to par with the newest technology. And yes, I think that there is some, in some way or form, you will see that happening. I think it's just a matter of time before you find that transgression going back, Guyanese going back from the US to Guyana and wanting to work in Guyana. And I encourage everyone because we have a tremendous shortage of medical and nursing professions in Guyana. So anyone from here who want to go back in Guyana, we welcome them.
Great. Thank you so much.
Sure, good, thanks, goodbye.
So we are here with Tony Subraj. So Tony, wonderful event, wonderful initiative. It's such great work that you and your family have been doing for years. But my main question is, why did you choose this hospital?
Okay. So we have been, I guess, entrusted with Northwell for so long. A lot of my family members have gone through their system, and they have been nothing but professional and dedicated to the service of others. And that just touched me. That's why it just made sense to do a partnership with Northwell.
Now, Dad, looking down on this, I mean, I had the pleasure of interviewing Dad many years ago, and I know personally of all of the hard work that he's been doing, all of the hard work that he's even still doing in Guyana. What do you think Dad is thinking of you today?
I hope proud. Honestly, Dad was a giant of an individual, and I just hope that I'm filling his shoes and continuing his legacy and reaching as many people as we can to help.
Well, Tony, thank you so much. This
Thank
is going
you.
to help so many people. God bless you and your family.